Namaste. Welcome everyone. I am Dr. Monika Pansari. I am a Senior Surgical Oncologist specializing in breast and gynecological oncology in Fortis Hospital, Bangalore. Today we are going to discuss a few topics about surgical oncology. Mainly what is the role of surgical oncologist in the treatment of cancer. So when one patient is diagnosed with cancer, there are different specialities which comes into the picture. Various specialities have different roles. Surgical oncologist, medical oncologist and radiation oncologist. And it's very important for patients to understand what specialty plays what role. So we as surgical oncologists play a very important role which you all need to understand, because many a times patients, they do get confused about the comprehensive cancer treatment what we cater to for all our cancer patients in Fortis Hospital. So as a surgical oncologist, what is our role? The first and foremost most important role is for the diagnosis of cancer. So for confirming the diagnosis of cancer, one has to undergo a small procedure called biopsy. Unless the biopsy is done, we are not very sure whether the tumor is malignant or a non-malignant tumor. So especially the tumors which are on the surface of the body, like breast tumor, tumor in the soft tissues, surgical oncologists will perform a procedure called biopsy, or a core biopsy we call it as in our medical terminology, that confirms the diagnosis that the tumor is cancer. Many times patients, they do come to us with blood in the stools. That is, in that situation we will ask them to undergo colonoscopy and various other tests, and again to undergo biopsy, which is done by a medical gastroenterologist to confirm the diagnosis that it is cancer. So first foremost important role of surgical oncologist is to diagnose that the tumor is cancerous. And then comes the next role is to offer the surgical treatment to get rid of that cancer. So before planning the treatment, we will do a comprehensive workup and a multidisciplinary tumor board to discuss and plan out your treatment. So for that, again, a series of evaluations are needed. We call that how do the staging workup for the cancer treatment. So once the staging workup is done, so depending on the stage where the patient belongs to, we offer them different treatment options. So if it is, for example, vaguely, if it is an early stage, we offer them surgery. So surgery in a cancer patient is performed by surgical oncologist. So that again is a second important role of a surgical oncologist. So what are the types of surgery? It again depends on the tumor where it is arising from. For example, I mainly deal with breast and gynec cancers. So for breast cancer, we offer different kind of surgeries like breast conservation surgeries, mastectomies and reconstruction as well. For example, a patient is diagnosed with head and neck cancer. So there will be different kind of surgeries which a surgical oncologist will offer to you and will discuss with you in detail. If a patient is diagnosed with a locally advanced disease, then again there is a role of surgery wherein you might be offered chemotherapy upfront followed by surgery. So for surgical oncologist, the most important role is removal of the tumor with the normal surrounding tissues to make sure that the tumor is removed completely. So that is again very important role what a surgical oncologist plays in cancer treatment. Following surgery, whether any additional treatment is needed or not needed, that again we will discuss after the surgical removal of the tumor, depending on the stage what you belong to. One more thing which you all should understand is that it's not only surgical, we all are basically artists, right? We are removing the tumor in a very precise manner without troubling you, without causing any damage to the surrounding structures. Many a times to get the perfect cosmetic outcome or a functional outcome, we combine our surgical oncology procedure with plastic surgeons as well, especially when it is on head and neck tumors, on breast cancers, where the cosmesis plays an important role. So in that kind of situation, we surgical oncologists, we work in team with plastic surgeon and give the patient the best outcome which they should have after the surgical oncology treatment. So this is what the role of surgical oncologist is in cancer treatment, which always is in association with medical and radiation oncologist to offer you the best treatment outcome.